Yes, thank you, Dr. Neha Kakkar. Good
Yes.
evening, good afternoon, and good morning. This is the 1778th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Paul Joseph from Canada. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. The international session is from 8:30 to 9:30 in English, and from 9:30 to 10:30 we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again, and you can subscribe the same without paying any money. The purpose of these sessions are to take homeopathy to every home around the world. And let me come to today's guest. As you all know, today our guest is Professor Dr. Paul Joseph, BHMS, R.Hom, Canada, PG Diploma in Acupuncture and practicing in Toronto. And he is a former professor, Homeopathic Medical College under Tamil Nadu MGR Medical University, India. And he's an author and written various medical articles and published two Tamil books on health and Kavita. That's on poems. He's a radio host doing a radio talk shows on health and politics in Geethanjali for the last 15 years, doing talk show on health and TED TV in Canada for the last 10 years. Today, Doctor will be talking about dual scale of SECALE COR. Doctor has made so many beautiful presentations in this forum. All presentations were exemplary, brilliant. And so let us see what Doctor has to say about this SECALE COR in this evening. We proudly welcome you, Doctor.
Is it audible, my voice?
Yes, yes.
Yeah, good morning, good evening to everyone, because in Canada it's morning. That's why, right? Yeah. So I really appreciate the members of IFPH to organize such a valuable seminar, right? The people, those who are participating from all over the world and promote the homeopathy. And also the IFPH invite always the newcomers, the new speakers, right? The new budding homeopaths enter into the teaching field. So really, I appreciate the organizers, especially Dr. Sai Kuti and Danish and the other members of organizers. Today, I'm going to discuss about 2 cases with the remedy, which is sharing.
Yes.
So this is a very interesting case of antiphospholipid syndrome. How many of you know about this syndrome? Antiphospholipid syndrome. Anyone? I think it's a very rare one, but not rare. I can't say it's a common, but it's very difficult to diagnose. Such a way slide. So yeah. So one patient came to me. This patient is a age about 46, male. He has been. I have been treating him for various illness even before COVID. So after COVID, it's about 3-4 years later. He came recently. It's about 2 months ago. Before I was treating him for various illness, especially the urticarial rashes, right? So he was all right with some few remedies, Epis and Attica uranus I prescribed. He was all right. It's a chronic case of Attica uranus. But after the COVID, he came. Not after COVID. It's about 2 months ago. This patient came to me with all this report, right? Then I asked her history. What kind of history? It's a severe abdominal pain, spasmodic abdominal pain. And immediately he went to the emergency, the Western Hospital. And they took all these diagnoses and everything. So finally they found out there's a occlusion in the left renal artery. And because of the CT scan, you can see here. And after that, they prescribe some medicines and anticoagulant remedies, but it won't suit him, and then they ask him to stop that one. Then they give a little painkiller, pain analgesic prescription. So 2-3 days he took, and then after that he came to me. Then the final diagnosis, they said, right, with the various tests, this is the diagnosis, antiphospholipid syndrome. So what is this? Just we go into little detail about antiphospholipid syndrome. Is a condition in which the immune system mistakenly creates antibodies that attack tissues in the body, various tissues in the body. These antibodies can cause blood clot to form arteries and vein. So that is the main things, because they found out there's a thrombosis, blood clot in left renal artery. Blood clot can form even in the other parts of the body too, because of this antiphospholipid syndrome. Maybe leg and lungs and other organs, especially in kidney and spleen, usually it's affected. So later on, this clot may lead to heart attack and stroke and other condition. Many of you know. So in most of the case, when I referred this antiphospholipid syndrome, especially during pregnancy, so it can result of miscarriage, stillbirth, right? So there's no other peculiar symptom, but in Western medicine, they said there's no cure for this uncommon condition, right? So this is the story of, so I got it from various sources, right? Anti-APS means antiphospholipid syndrome is a disorder of recurrent arterial and venous thrombosis. Mainly in pregnancy, it may cause pregnancy loss, abortions, right, in the early trimester. So there are, and this disorder, this APS disorder may be associated with the other condition like autoimmune disease, because it's an autoimmune disease. APS itself, it's an autoimmune disease, like always associated with the psoriasis, SLE, so kind of things. So this is the mechanism I found out in the pathophysiology of APS. I can say APS, right? So you can understand. This APS, right, the pathophysiology, when I referred in the Google, they said a lot of the condition like. So you can see here, A, B, C, D, E, F, G, H, like that, how it's formed. The first, the epithelial cells are directly impacted by the APL, antiphospholipid. It's causing, that's a protein, antiphospholipid. It's a protein, right? It increases in the tissue, right? As well as is indirectly with the APL related with the platelets microparticle reduce endothelial injury, right, resulting thrombin generation. So like that they explain. The APL leads to increased tissue factor expressing by monocytes because it's a autoimmune disease. The WBCs, especially monocyte involved, causing increased thrombin generation. So that's why it's the coagulations comes. And the related platelets and leukocytes activating leads to platelet leukocyte aggregations. So that's why they couldn't find out why it's happened, right? So that's why they put it in the list of autoimmune disorder. If they doesn't know the exact cause, so most of the diseases, the international classification of disease, they put it in autoimmune disease, right? In the list of autoimmune disease. So like that, the aggregation came, finally this protein involved and APL protein involved and the thrombosis, the clots came. So this is the story of APL. So usually the vascular thrombosis, and in pregnancy also it's causing various symptoms, and CNS symptoms also. Various neurological disorders have been occurred association with the APL antibodies, right, such as stroke, epilepsy, dementia, and the myelopathy. So different kind of things it's happened. Not only the thrombosis, there are other CNS disorders also. Especially, I think many of you know about the Guillain-Barré syndrome and other the disorders also involved. So here the picture explain the AP antiphospholipid antibodies, right? Hypercoagulable state, right? Especially in artery and venous. And here the other symptoms also, the patient may have migraine. Nowadays, in Western medicine, they said there is no cause for there's no pathology, not pathology, there is no actual etiology, right, for migraine. So these are the symptoms. These are the pathology may behind those kind of things. Sudden stroke, transient ischemic attack. There is no such a history. The previous history of thrombosis or previous history of embolism or previous history of any vascular disease. Suddenly, most of the people, most of the patient, they get TIA, transient ischemic attack or stroke, whatever. And pulmonary, sudden case of pulmonary embolism, right? Sudden blockage, sudden occlusion of artery and vein. So this disease, the APS may be the cause of all these things. So during pregnancy, APL is one of the symptoms so one of the etiology for abortion, especially in the first trimester. You can see in fetal early miscarriage, fetal loss, premature, stillbirth, intrauterine growth retardation, fetal distress, so the kind of things. And the other side, the maternal side also, it may happen. The venous arterial thrombosis, microvascular thrombosis, that is very important in APL because it's affect the small vessels, right? Then migraine, eclampsia. So you can see different kind of the ailments which can caused by the APS. So this is the medicine they prescribe for the patient. So this is the Epixapam, right? It's used helping prevent stroke, blood clot in the people who have arterial fibrillation and so and so, right? So this is the anticoagulant. But this medicine, it doesn't work for this patient, so they stopped the patient has different kind of allergic symptoms. So that's why they stop and they prescribe only the analgesic drugs. So after that, he came to me, see, on the basis of the pathology, on the basis of the diagnosis from the Western side. So I referred the NER, repertory of herring guiding symptom, by NER. You can see the abdomen. Exactly the symptom is there. You know how many? It's about some, a few hundred years ago. It's about some 150 years ago. They described in such a way. Abdomen. You see abdomen, and I referred in the chapter abdomen. Here you can see blood vessels, abdomen, under the abdomen, blood vessels, thrombosis. Only one remedy, single remedy rubric. See, SECALE COR. So how it's wonderful, right? So immediately, without asking, this is another patient, okay. So without asking, just I prescribe the SECALE COR. So after that, after it's about 2 weeks, the pain was a little subside. And after 1 month, he went to the same physician, and there's no such a symptoms. So they told him to come after 3 months. We have to do the rescanning or CT scan or whatever. Right now, the patient, after 2 months, the patient came to me in the month of May. So till the patient normal, he's doing his work, right? He's a maintenance technician in the big apartments and various offices. So, so this was the history. So I'm waiting for maybe next month, in the month of August, maybe August or September, they may take a scan. Then in the next seminar, I'll tell you so what's happened. But till now, patient doesn't have any symptoms. So this is a very interesting case of the SECALE COR, right? And the second case, very profuse. I will read I'll read the case. Here I have the girl, age about 17 or 18 something, and the menses very profuse. They diagnose the menorrhagia. The period starts, then it continues until the next period. Then in between, few days subside, then again starts. So like that, continuous, profuse, very painful, severe painful, daily she is suffering and taking painkiller, right? Daily 5-6 pads she used to change. Very bright red, irregular menses from the beginning, from the menarche, that was irregular. But this problem, the profuse bleeding and menorrhagia, it's about last 4-5 months. Right? She was anemic, and you know all the things, right? What happened? So like that, so she came to me, and so I repertorized. Again, the SECALE COR came. Why I'm telling all these two comparison? This is a very interesting case. Because that's why I gave the title, right? Dual scale. Maybe the rhyming, right? Scales, SECALE, COR, like that, right? That really this duality of SECALE COR and double role in SECALE COR, like a hero and a villain. You know, usually we call, right? One person, he act as a hero, at the same time the villain, right? So like that, the SECALE COR also has a dual role, Why it's like that? I will explain. Because in one case, it cause right, it control the bleeding. The another case, it promote the clots. So sorry, it dissolve the clot. There's a bleeding and clots. When we discuss about just now we are going to discuss about these two. Well, there are vascular spasm, peripheral vascular spasm, and the vascular spasm in the various organs, right? Then the other side, the hemorrhage. The other side, the thrombosis. See, the dual role of SECALE COR. Mainly the SECALE COR, I think many of you, it's a familiar remedy. So when you think of SECALE COR, most of us, we know the gangrene and all, right? The cholera and different kind of things. But here, you are going to see different perspective of different view of SECALE COR. This is from, the vegetable nosode. SECALE COR is nothing but it's a vegetable nosode. It's grow, usually it's a fungus. Grow in the fungus present in the wheat, barley, and even in our India, the paddy field, right? Grasses. So it grow over there. Usually, even in the real paddy field, and also in the Western countries, they store, for winter season, they store all the rice and rice. Rye means the RYE, right? The dried the wheat or something they store, and during the winter time they put in they use as the cow's food, right? So usually in the summertime, so when the cows, they just eat in the grass and these kind of weeds and all, so automatically it goes inside. This fungus goes inside and causing, it's about in ancient time, there was an epidemic in Germany. From that, it's about some few hundred years, this was noticed, right? When they eat this kind of fungus, the cow, they get aborted, right? So that's why it's called ergotism. You know ergotism. I think many of you heard about this word, right? So it can cause a the other symptom too. So from that, I think the Hahnemann, because this drug is proved by Hahnemann. And this is the story. And again, there are different kind of SECALE group, right? There are, I think, more than 10, 15 different kind of fungi, but Hahnemann took only SECALE COR. SECALE cornatum, that terminology, it's originated from Latin words. SECALE means rye. Rye means the wheat or the kind of grass kind of plants, right? The cornatum means horn, like a horn, right? And when I refer this into the lectures, the Farrington Materia Medica, Farrington Clinical Materia Medica, there are a lot of information. You can see, right? There are 4 or 5 pages of illustration he described. Very interesting story he described. But in case of, I will tell you, this nosode, so this nosode, all right, it's a poison. It contains ergots, kind of alkaloids, right? It can cause, or it can cause, or it may leads to the uterine muscular spasm and other act on the blood vessels.
Excuse me, doctor. The screen sharing is not there now. Please restart.
Yes. Okay. So like that, there are the sickle core, the especially this action, sphere of action on various organs in the body, muscles, uterines, and blood vessels, and blood itself, because that's why the thrombosis and coagulations, the problem came, right? And the wall of the uterus, muscular layer of the uterus, and also the same way the walls of the artery, vasomotor action, and the stomach and intestine, you know that, right? The color, the diarrhea, and these things. Then and also the peripheral artery, especially on the skin, right? That's why the gangrene. You know all the stories. I'm not going into detail. So here, in the menses, irregular, copious, dark fluid with pressing, labor-like pain. So in the Clark Materia Medica and Farrington Materia Medica, even also in the skin, they mention hourglass contraction, right? So the patient is really this the girl, she explained in such a way, like he just put like that, right? Doctor, my pain, while right in the menstrual pain is like that. So that's called hourglass contraction, right? She doesn't know, but she explained in such the body language. And the patient feel the bearing down sensation. And here, but exactly, this patient, she doesn't tell about those things. But in Materia Medica, it mentioned bearing down sensation and coldness on the affected part, right? And the sickle core, the ailments from its very interesting things I observe when I read the literature, right? The ailments from smoking. What kind of thing? Because you know the right things in smoking mainly it's affect the right the wall of the arteries, right? Arteries and vein. So here, that's why the peripheral artery, right, spasm and peripheral artery damage, and it may cause injury and the gangrene, it's happened. But when you compare with the smoking, like especially there are other remedies also, ailments from smoking. Nux vomica is there, caladium is there, then the sepia, ignatia. But ignatia, I found out that in the literature and also in my experience, most of the woman, the husband who has a smoking habit, they don't like it because of the smell of ignatia. That is a right smell of ignatia. Sorry, smell of smoking the cigarettes. It can aggravate the woman's right, mentally and physically, the other things. So they can't tolerate the smell. That is ignatia. But the other caladium, that's a different thrombosis, and sepia, that's also right, different things. And the second ailments from suppression of milk. Suppression of milk due to various, nowadays, you know, right, various reasons. One of the reason nowadays, cosmetic reasons. And also the lifestyle, most of the women, they have to go for work and they suppressed. Because of that, they suppressed because of the modern lifestyle, right? So that the sickle core may help for those kind of things. And suppression of sweat. There are other remedies too, suppression of sweat, but mainly the then the other suppression like logia. Logia is a you know what it is, right? For various reasons, suddenly the logia suppressed. So then suppression of sexual excess, suppression of sexual excess, that's also causing in the same remedy, right? The other remedies also is there, right? But here in SECALE COR, again, suppression of sexual excess or desires with a vascular ailments. Vascular ailment means the palpitation. Most of the patient, they get after suppression of sexual excess, then it may lead to palpitation. So again, the vasomotor pathology behind that. And the ailments, the other one, the ailments from injuries. There are different remedies, I think most of you know about, but in this SECALE COR, the ailments from injuries that may lead to gangrene, right? There are some other remedies, you know, differential diagnosis, arsenicum and SECALE COR, androxinum, there are different remedies are there, right? So like that. Here, the other important symptoms, right? I have no health since aborted. Ailments from or ailments after abortion. There are many remedies, but this is a red line symptoms remedy, very important remedy, that is a SECALE COR. So SECALE COR, the modality, aggravations, heat, warmth from covering in all affected part, mainly the amelioration, cold air, right? Uncovering part. The same arsenic album and veratrum also is there, but there are different, right? Differential diagnosis. Again, this we discussed, this the sphere of action, right, in the blood vessels, uterus, nerves, and the ergotism. Again, I have to tell you, because it's act on nerve too. Convulsion after, right, abuse of the alkaloid of the remedy. Sorry, the SECALE COR. And here, the other characteristic symptoms of SECALE COR: mind very stupid, half sleepy conditions. There are, you can compare opium, and dullness all over the dullness of all the sense, mild raving delirium, great anxiety, fear of death. And here, very important terminology, right? This is also the new terminology, right? Mental alienation. So what it means? It's very, very interesting. Mental alienation. Mental alienation is nothing but, it's also known as psychological alienation, referred to the state of feeling of detached from the family, detached from the society, detached from the world. That's a feeling of like that, right? That is a delusion. Here, you know, LSD. What is LSD? This is one of, right, drug, like opiate drug, very costly, even like, you know, the brown sugar like that, right? It's a very costliest drug than the other, what do you call, the narcotics. We can say narcotic drugs, LSD. Even like a poppy seeds size of drugs can lead through for 2-3 days the patient, right, in a narcotic stage, right? The addiction. Especially this drug, it's prepared from this plant, this fungi, right? One of the source. That's why most of the Afghanistan and the other the countries, they have this kind of right things. And the same, the mental alienation. That's why because they want to, right, get it from, just they wanted to come out from all these, the problem from the family and from the society. Just they just consume this drug and feel happy themselves. So that kind of, right. And in female genitalia, you can see Most of the symptoms, this is, I got it from the Kent material, Kent repertory, right? Menses black, bright red, right? And clotted, especially. But for this patient too, the same. Black, sometimes bright red, and it's like fluid-like, it's passing like a fluid. It's a forcing like, right, like a river. The patient explained that it's continuously, right, it's flow like a river, that kind of thing, with the small clots, right? Very offensive too. This is already we discussed the ergot, right? Ergotism. Here, you can see the side effects of this SECALE COR side effect, because in toxic side effect. So that we used in a homeopathic way, right? What can cause can cure. The side effects, contraindications include atherosclerosis. Again, it acts on the arteries, the blood vessels, right? Thickening of blood vessels. The Berger's disease, Raynaud's disease. See? So we give the same thing, and this kind of patient comes, right? Then side effect of ergotamine. Ergotamine in that's the alkaloid of ergots, or ergotamine. That's an alkaloid of SECALE COR, right? So it causes vomiting and diarrhea, right? Vasoconstriction as well as spasm, both constriction and relaxation, right? The other one of the interesting symptom here, in diarrhea, the patient feels in SECALE COR, sensation of anus wide open. The wide open means it's already is open. No feeling, nothing. So that's why the diarrhea. But in arsenic album and veratrum album, there are different symptoms, burning and the coldness, sweat, and all these things, you know, right? But here, the anus is wide open. And also there, because this remedy acts on, very interestingly, wherever the circular muscles control, wherever the circular muscles control, in cervix of the uterus, the bladder of the neck of the bladder. See, again, this remedy is useful for interesting in bladder, uncontrolled bladder weakness and all. And artery also. In the wall of the arteries, again, the circular muscles. So that's why the spasm and contractions. So it's very interesting remedy. I think most of the things we discuss. So that's why these two patients I prescribe in SECALE COR in 2 dimensions. One is the bleeding, to control the bleeding. The other, second case, to dissolve the thrombosis, right? That's the dual way of action in SECALE COR. So any questions?
So have you finished?
Yeah, almost
Excuse me,
done.
sir, I have finished the topic.
Pardon?
Have you finished?
Yeah, almost done.
Yes.
They're all differential diagnosis. Okay. The woman, the girl who is age about 18 years. So after 2 weeks, slowly the symptoms subside, right? The menses has become regular. It's almost now 6 months over when the patient came, right? So she was all right. The patient was happy. So it's a very interesting case. So any questions regarding this?
It's time for discussion. A beautiful heading is given, dual SECALE COR. Also, the specialty homeopathy medicine, it can use neither way. One case where there's a control bleeding, second is to dissolve the clot.
Yeah, that's why I put the name duality. And also in the construction, vasoconstriction and relaxation. That's the hourglass, right?
Yes,
That
sir.
that you can apply anywhere in the body, like as I said, in the uterus and the bladder, your urinary bladder, and the wall of the arteries.
Yes, good. So there's a question in the chat box. How do side effects include both bradycardia and tachycardia? So question.
Right. Okay, right. Bradycardia, yeah, that's also you can.
Sir, you have a question in the chat box, sir.
So wherever the muscles are there, that is the basic the pathophysiology of the sickle core, right? I told you the circular muscles. What it's called? That's right, non-striated muscles, circular muscles.
Yeah.
Wherever, yeah, non-striated circular muscles, wherever it's there, you can apply the sickle core. That's the basic fundamental which I observe from this.
Yes, sir. The question is about how do side effects include both bradycardia and tachycardia? It's a question.
Oh, both? What's that?
How do side effects include both tachycardia and bradycardia?
No, that's I don't have any experience with that, right? What I can talk in the experience and what we learn from the materia medica and from the patients. So that's why.
So it's often maybe depending upon the dose, the potency and sensitivity of the patient, it can produce some side effects.
Yes, maybe.
Okay. Then you mentioned about the couple of materia medica. So it's also nice. Farrington's materia medica, clinical materia medica, Clark's materia medica. The alienation of the symptoms detached from society. Then animals material medica. Then another point you mentioned about the nurse supporting the
Yeah,
hereditary
that's only
symptoms. It was published in
one symptom, right?
1890.
Single remedy symptom, right? It's a very interesting.
Yes, definitely. This
So I
is
have to
a
thank
monumental or
Dr.
classical
I have
work.
to thank in this forum. I have to thank Dr. Srinivasan, right?
Srinivasan, yes.
He introduced the nerve repertory.
He's a
Where,
legend. Yes.
yeah, that's right.
We have a session on this same paper a couple of days back. A doctor was presented. Then
Okay.
another one is that it was published in 1 year ahead of this Kent's repertory. It was published in 1896, and now 129 years passed.
Mm.
Then another work is there, the analytical repertory of mind. There's also good, excellent work. No doubt about that. Analytical repertory of mind.
All right.
Okay. It's
And
time for
here, the sickle core, the abortions, especially threatened abortions, and very contraction and relaxation of uterus, because you know the ergotin in the, this was they observed from the cow, right? When they eat in the field, then it's causing, it's like a, in the literature, when you go into deeper in literature, the ancient literature about sickle core, this fungus, and there was an epidemic in 18th, 19th centuries. So I think, sorry, 17th, 18th centuries. From this story, I think the Hahnemann took maybe the especially
definitely. We can see an essay in the lesser writings. There is always something in the old woman saying. It was
stories.
not Hahnemann. So we should acquire, or we should open our eyes and ears to all these things, all sorts of information, then prove it. That's the most interesting thing. It's time for discussion. Those who would like to participate, please raise your hand. A wonderful
And especially in the first trimester, the
presentation.
second
Yes,
abortion
sir,
takes place
please.
in sickle core in first trimester.
Yeah.
And it's one of the important remedy in my experience, in Canada, most of the patients come with this peripheral artery disease. You know why? Because of sorry. the peripheral artery disease, sorry, because of cold in the winter time, during the winter period, right? You know, minus 30, minus 40, it's common. So that time they have, because already they have a habit of, because of cold, they have, most of the patients, they had even male or female, right? There's no variations. Male or female, they do smoke. And one is the smoking, one, and number two, the exposure of cold. These two things are, right, affected them and in enormously and extremely, because extreme coldness and the continuous the habit of smoking. So this may lead to the peripheral vascular spasm that finally leads to the thrombosis or occlusion of arteries in the peripheral arteries. So finally end with the Raynaud's disease. You know what is the Raynaud's disease and the Berger's disease, right? So this kind of patients, maybe I had a experience uh, uh, about these cases, this kind of cases, maybe more than 100 I can say, right? So I used to prescribe the caladium and the caladium, first sickle core, then caladium. And also I forgot to mention about this, the APS case, antiphospholipid syndrome case. After that, after sickle core, I prescribed arnica, right? Just few doses of arnica, right? You know, the arnica, why I prescribe arnica, right? So any questions? Any questions or any one of you want to ask any question, you can ask, no problem. So we have another 10 minutes, I think.
Yes, the participation is also an important thing, sir. Yes. Please raise your hand if you have any doubts or anything to add. There's another question. Though anxiety and several other mind symptoms are listed, the basic action is on the physical plane. Sir, another comment in the chat box, sir.
Yeah, that's true. And also I forgot to mention this, the wide open sensation, right? Always somewhere I put a note, right? Wide open sensation. This also you can take as a mental symptoms, the mind symptom, right? Because they want to go out, right? They want to free from that. Always open, right? Even in mentally, even some symptom. That's why Dr. Rajan Shankaran and other pioneers, the key symptoms of the patients or materia medica, you can apply anywhere. There are some key symptoms, red line symptoms. Even that can be applied in the mind, that can be applied in the physic too, the physical general too. Right. Here, the another important the symptom is suicidal thoughts in the sickle core, right? There are many remedies in suicidal thoughts, suicidal tendency, but various kind of. When you go into deeper into the mind of the patients, or when you go into the deeper into the feeling, so different the method of suicidal thoughts. Some people, they want to just jump from height. What is the remedy? Jump from height, jump from hill, or jump from the 10th floor for 11th floor of a building, right? Aurum metallicum. Why the aurum metallicum? You know why aurum metallicum? Because they already there are wealthy and wealthy people, right? So that's why they couldn't able to tolerate their the loss. They couldn't tolerate their financial burdens. So that's why they are always in height. And drowning. What is that drowning? Anticrudum. Anticrudum, very sentimental guy, right? Always just he enjoy in the seaside and lakeside, wherever right. He enjoy the mirror of the moon, even in the river or in the lake or in right, and make stories, make poems, and finally he just get into the water, right? Drowning. Anticrudum is the thought, suicidal thought by drowning. What is natrum self? Natrum self cutting, right? Injury, cutting, by cutting arteries and vein or whatever, right? He just with a knife, like kind of things. So, lot of things are there. Any questions? Or you can.
Dr. Ram Parvesh Shah, please.
What's that?
Dr. Ram Parvesh Shah, sir, please.
Dr. Ram, how are you?
Thank you, Manoj ji,
Yes,
and
sir.
congratulations, Dr. Paul Joseph, sir. Very nice presentation, excellent session. Remedy, SECALE COR, and practical clinical remedy. SECALE COR is the best remedy for female. Constitution, lean and thin, weakness.
Scrawny.
Constitutional and weakness and internal heat, internal burning and skin, yani or body is the cold. The best SECALE COR remedy. And during delivery and bleeding uterus is a very good remedy. Very thanks, sir.
Yeah, and
Thank you.
also I had a case of that. Maybe next time I'll present this case. SECALE COR and causticum also I prescribe both remedies in different times. That's a case of Bell's palsy, facial palsy because of exposure to cold. Usually, you know that causticum is one of the best remedy, but here the spasm with the what do you call the facial spasm as well as paralysis, right? Bell's palsy. So continuous spasm. So because of the lack of blood supply due to cold, the winter. So that's why first I prescribe causticum because it's the right side one and exposure to cold. Then as an intercurrent remedy, because of spasm of the local arteries and the like a convulsion, right? Even ergotism, you can say ergotism, right? Convulsion, spasm of different kind of muscles. So that's why I thought of that. It's about maybe a few years ago. I prescribed the SECALE COR, a few doses as an intercurrent remedy. So like that, a lot of experience we can. Dr. Danish?
Yes, Doctor, it's really a very good session. And you really rocked with the SECALE COR. Both cases were really excellent, and the definition itself shows the beauty of the presentation. And the naming of the subject itself is really interesting. And the presentation was top class. And we were able to understand what is SECALE COR, how it works and where it works. As we know that whenever there is some occlusion in the blood flow, and there is every possibility of necrosis in the tissues, and as a result, lot of cells may be damaged, and as a result, the persons may need to be amputated. In those conditions, we have an excellent remedy in SECALE COR. We have seen it several times in our practice that several SECALE COR can bring back the best flow towards that particular necrotic area when it was given to the patient, the blood flow will naturally start coming coming slowly, and the cells around the area become flourished and nourished, and then they become grow rapidly, and as a result, there will be a possibility of recovery even without amputation. We were able to cure the patient, and not only that, the recovery is the rate of recovery is really unbelievable. That much of speed with which that kind of speed SECALE COR can do to the patient.
Yes, definitely, Dr. Tanesh. Yes.
Yes.
Time for to wind up the session. May I invite Dr. Veena takes a sort of thanks. Dr. Veena. Dr. Veena, are you there? Please unmute.
Yeah. Sir, good evening.
You
Really
can make your comments as a lot of thanks, please. Yes.
really a wonderful session, sir. Thank you so much for giving us insights about SECALE COR and your experiences. These are mind-blowing and making us learn every day. Thank you, sir.
Thank you. Thank you.
Well, we know always Dr. Paul Joseph is a person, is a specialist, making some special observations and capable of presenting in variety of forms, not only a single way. This is a typical example. The heading is also very catching on the duality of this SECALE COR. Nice presentation, as well as you referred a lot of classical works. That's the most important thing. The Farrington material, the Clark's material, you can see a lot of references in how the material evolved. Well, all these things, the basic things a homeopathic student should learn, is only available in the class material, I think. Anyway, nice presentation. So with that remark, let me conclude today's English edition. Day 1778. We'll be back again tomorrow. Till then, goodbye. And Dr. Shaila to continue the program Malayalam. Thank you.
Thank you. Thank you.
Thank you, Dr. Thank you, Dr. Manoj. Thank you, Dr. Paul Joseph, sir.